Hello everyone, welcome back to another recall session. So today we are going to discuss with you about anatomy recall questions of INI-CET 2023. So let us start discussing the questions. The first question is, which of the following vessels is involved in the condition affecting the region marked red in the image shown below? So guys, this is the region marked as red. So this one is ventral portion and this one is dorsal portion. This is pyramid and this one is inferior olive. So now they are asking that which of the following vessels involved in the condition affecting the region marked in the red. First of all, we have to master this image and what are the different tracts that are seen in this image. So let us discuss this image in detail. See, this one is pyramid. This portion is pyramid. This one is hypoglossal now. Then this one is inferior olive. This one is medial lemniscus. This one is the medial longitudinal fasciculus. This one is nucleus ambiguous. Ambiguous, there is a vagus nerve arising from that. This one is dorsal spinocerebellar tract. This one is This one is ventral spinocerebellar tract, and this one is spinothalamic tract. This one is descending tract and nucleus of trigeminal nerve, and this one is vestibular nucleus. So this is actually the axial section that taken at the level of medulla. See, the marked red portion is affecting the ventral spinocerebellar tract, spinothalamic tract, dorsal spinocerebellar tract, vagus nerve, as well as descending sympathetic tract and vestibular nucleus. Nucleus ambiguous is also affected, which transmit the vagus nerve fibers. So this all involvement points toward the diagnosis of lateral medullary syndrome. And lateral medullary syndrome, due to the affection of posterior inferior cerebellar artery that is known as pica. So the answer here is B, posterior inferior cerebellar artery. The next question is, which of the statements given below regarding the muscle shown in the image are correct? There are totally four statements. First of all, let us see the image. This one is image. This one is the image of rhomboidus minor and rhomboidus major. So let us see the statement and make the statement true and false. They retract the scapula along with the middle fibers of trapezius. This one is true. They elevate the scapula along the fiber of trapezius. This one is true. They rotate the scapula, tilting the glenoid cavity inferiorly. This one is again true. And the last statement is they rotate the scapula, tilting the glenoid cavity superiorly. This one is false. The regarding the statement given below, the statement that are true are 1, 2, and 3. So the answer here is 1, 2, and 3 because rhomboidus minus and rhomboidus major main action is elevation and retraction of the scapula and tilting the glenoid cavity inferiorly. The next question is match the following. Facial nerve. Facial nerve actually responsible for the taste from anterior two-third of the tongue because the coda tympani nerve which is the branch of facial nerve, is responsible for the taste from anterior two-third of the tongue. So one is B. Spinal accessory nerve is responsible for shrugging of the shoulder because that is supplying the trapezius and serratus anterior muscle. So the two is A. The third statement is glossopharyngeal nerve and the test from posterior one-third of the tongue. So that is C. And mandibular nerve is responsible for chewing. So that is D. So B, A, C, and D. The answer here is D. The next question is which of the following muscles are supplied by superior gluteal nerve? So superior gluteal nerve supplies gluteus medius, gluteus minimus, and tensor fasciae lata, but the piriformis is supplied by nerve 2 piriformis. So the answer here is C, 1, 2, and 3. The next question is 25-year-old male presented with symptoms of inability to flex the distal interphalangeal joint of fourth and fifth digits. He was not able to hold a piece of paper between his fingers. So what is the likely site of injury? They are telling that inability to flex the distal interphalangeal joint of fourth and fifth digit and not able to hold a piece of paper between his finger means card test is positive, and this clinical scenario is suggestive of ulnar nerve injury. Let us label this for all alphabets. This one is head of humerus. This one is shaft of humerus. This one is a lateral epicondyle. This one is medial epicondyle. So ulnar nerve actually passes from the medial epicondyle of the humerus and the labeled structure is C. So the answer here is C. The next question is which of the following muscles form the pelvic diaphragm? Pelvic diaphragm is actually formed by iliococcygeus and pubococcygeus. That both form a muscle that is levator ani. And levator ani is the muscle that forms the pelvic diaphragm. Fore part of the pubococcygeus is responsible for the formation of pubococcygeus and which form the levator ani muscle. Puborectalis, puboanalis, puboperinealis, and pubovaginalis. So from the given option, ileococcygeus and pubococcygeus are the true statement, and obturator internus and deep transverse perineum does not involved in the formation of pelvic diaphragm. So the answer here is A and B, option number A. The next question is anterior relations of the third part of the duodenum are all except superior mesenteric vessels, loops of jejunum, root of mesentery, and the last option is fundus and body of gallbladder. Let us see the anterior relation of duodenum. Anterior relation of duodenum is superior mesenteric vessels, root of mesentery, and loops of jejunum. Let us talk about the posterior relation of the duodenum. This is actually in the third part of duodenum. It is actually right ureter, right gonadal vessels, right psoas major, abdominal aorta, and inferior vena cava. The superior relation of duodenum is head of pancreas, and the inferior relation of duodenum is lobes of jejunum. So jejunum lobes are related with anteriorly also and inferiorly also. So let us see superior mesenteric vessel in anterior relation. Yes. Lobes of jejunum. Yes. Root of mesentery. Yes. Fundus and body of gallbladder is not related with duodenum anterior relation. So the answer here is D. Fundus and body of gallbladder. The next question is arrange the following afferent columns in the floor of the fourth ventricle from medial to lateral. General somatic, general visceral, spatial somatic, and spatial visceral. So, guys, to solve this kind of question, I am giving you a simple mnemonic that general, spatial, general, and spatial. You have to remember like general, spatial, general, spatial. And then in the floor of fourth ventricle from medial to lateral, you have to remember like medial is visceral and lateral is somatic. So general visceral, spatial visceral, general somatic, and spatial somatic. So from this question, it is 2, 4, 1, and 3. So the answer here is B. See, from medial to lateral, general spatial, and medially it is visceral and laterally it is somatic. This is the way the column in the fourth ventricle afferents are related. General general spatial, medial is visceral, and lateral is somatic. Match the following muscles with the respective actions at the shoulder joint. So let us see the action of the muscles one by one. Pectoralis major is responsible for flexion at the shoulder joint, as well as it is responsible for adduction and medial rotation. Supraspinatus is responsible for abduction at the shoulder joint. Infraspinatus is responsible for lateral rotation of the shoulder joint, and latissimus dorsi is responsible for extension at the shoulder joint. So 2431 C is the answer. Pectoralis major is responsible for flexion. Supraspinatus is doing the abduction. Infraspinatus is doing the lateral rotation, and latissimus dorsi is responsible for extension. The next question is given below is the image of 33-hour chick embryo. Which of the following is derived from the marked structure? See, this one is the marked structure. This marked structure is known as paraaxial mesoderm, and the structure that derived from paraaxial mesoderm is ribs, because kidney develops from metanephros, Dorsal root ganglion develops from neural crest cells, and parietal pleura develops from lateral plate mesoderm. So the answer here is ribs. Let us move on to the next question. Which of the following is false regarding the anatomy of the adrenal glands? The first statement showing that right adrenal gland is semilunar in shape. This is completely false statement. Right adrenal gland is pyramidal in shape, and left adrenal gland is semilunar or crescentric in shape. Let us see the other three statement. The left adrenal gland is closely related with tail of pancreas and spleen. This one is true. The adrenals are yellow on gross appearance. This one is completely true because adrenal is covered by fat pads. And the adrenals are retroperitoneal in location. Completely true. So the answer here is A. Let us move on to the next question. The sulcus located deep to the marked structure is. This one is the pterion, and the structure that located deep to the marked structure is the stem of lateral sulcus. Because the stem of lateral sulcus is located when you go deep to the pterion. Central sulcus, inferior frontal sulcus, and superior temporal sulcus are not related with the deep location of pterion. Let us move on to the next question. Given below is the illustration of a transverse section of the heart. Identify the marked structure. This one is aortic valve. This one is pulmonary valve. This one is mitral valve. This one is tricuspid valve. This structure marked behind aortic valve, which is extended from aortic valve to mitral valve, is known as subaortic curtain. So the answer here is subaortic curtain A. Let us see the different options. Posterior leaflet of mitral valve, no. Aortic valve leaflet, no. And entry aortic sinus, this is also not true. So the marked structure here is subaortic curtain. The next question is identify the structure marked as A. So let us label these all for alphabets first of all. The A is terminal bronchiole, the B is respiratory bronchiole, the C is alveolar sac, and the D is alveolar duct. So the marked structure is B, terminal bronchiole. The next question is the fibers of the internal oblique muscle and the transversus abdominis muscle contribute to which boundaries of the inguinal canal walls? This is a completely factual question. Let us see what is forming the boundary of inguinal canal walls. Interior boundary is formed by external oblique aponeurosis. Posterior boundary or posterior wall is formed by transversus abdominis and conjoint tendon. Roof is formed by arched fibers of transversus abdominis and internal oblique muscle, and floor of inguinal canal is formed by grooved upper surface of abdomen and pelvis inguinal ligament. So the question here is fiber of internal oblique muscle and transversus abdominis muscle contribute to which boundaries of the inguinal canal walls? So internal oblique muscle responsible for roof and transversus abdominis muscle responsible for roof as well as posterior wall. So the roof and posterior wall, these both are formed by uh, internal oblique and transversus abdominis muscle. So the answer here is A, 2 and 4. The next question is which of the following is a function of the margin layer? This is actually the histological picture of adrenal gland. Let us label the layer of this adrenal gland. This one is zona glomerulosa. This one is zona fasciculata. This one is zona reticularis. So the marg layer here is zona glomerulosa, and the hormone secreted by zona glomerulosa is mineralocorticoid, and the function of mineralocorticoid is sodium and water retention. So the answer here is B. The next question is a patient's right hip drops when he takes the right foot of the ground. Which of the following would not be involved in this patient? Superior gluteal nerve, gluteus medius, gluteus minimus, and sciatic nerve. This is showing the Trendelenburg test positive. The structure affected is right superior gluteal nerve, right gluteus medius, because this is supplied by right superior gluteal nerve, and right gluteus minimus. So superior gluteal nerve, gluteus medius and gluteus minimus are affected, but the sciatic nerve is not responsible for a positive Trendelenburg test. That palsy is not involved in this case. So the sciatic nerve is normal. So the answer here is sciatic nerve. The next question is which of the following statements is incorrect about the anomaly shown below? So this is actually the sacrococcygeal teratoma, and which is due to persistence of pluripotent cells of primitive streak in sacrococcygeal region. So let us see the options. It occurs due to the persistence of precaudal plate. This one is wrong because it is due to persistence of pluripotent cells of primitive streak. The next option is it occurs due to the defective migration of primordial cell to the genital ridge. This is true. The next option is it contains skin, cartilage and bone. This is true. And the next option is it is a benign tumor of coccyx. This one is also true. So the answer here is A. It occurs due to persistence of precaudal plate. The next question is identify the arrow marked structure. So let us label first of all this figure. This one is superior vena cava. This one is ascending aorta. This one is pulmonary trunk. This one is descending aorta. This one is esophagus. This one is left azygous vein. So this is arrow mark structure is suggestive of C. Pulmonary trunk. The next question is what is the role of the marked structure in the given image? The marked structure the marked structures are subthalamic nucleus and which is motor function because the defect subthalamic nucleus lead to loss of dopamine or decreased dopamine and that will lead to Parkinsonism and that will present with tremors. So dopamine secreted by subthalamic nucleus is responsible for motor functions. The next question is which of the following muscles are supplied by lateral plantar nerve? Let us see the different options. Abductor hallucis is supplied by medial plantar nerve. Flexor digitorum accessorius is supplied by lateral plantar nerve. Flexor hallucis brevis is supplied by medial plantar nerve. First lumbrical is also supplied by medial plantar nerve and first introsci is supplied by lateral plantar nerve. So the answer here is A, 2 and 5. The next question is the marked structure sends efferents to which nucleus of the thalamus? The marked structure is fornix. Fornix arises from hippocampus. and ends by giving efferents to the interior thalamic nucleus. So the answer here is C, anterior nucleus of thalamus. The next question is on neurological examination, a patient is not able to identify an object but is able to recognize the object from its texture, color and pattern. Which of the following is likely to have been affected? This scenario is suggestive of visual agnosia, and visual agnosia is due to the affection of inferior temporal lobe. So the answer here is D, inferior temporal lobe. The next question is apocrine glands are present in which of the following? The option here are face, scalp, palms and soles or axilla. Apocrine glands are atypical sweat glands which are present in the axilla, perianal region, periumbilical skin and mons pubis. So the answer here is axilla because it is the atypical sweat glands. So let us move on to the next question. Which of the following is a tributary of inferior vena cava? See guys, this kind of question you have to master your vascular anatomy, both arterial as well as venous anatomy of the body to find out actual structures and tributaries as well as branches of arteries and veins and trunks, all of that. So let us look at the options. The options are left inferior phrenic vein, left suprarenal vein, left gonadal vein, and right ascending lumbar vein. So to answer this question easily as well as effectively, we have to see the trunk of inferior vena cava as well as tributaries of inferior vena cava anatomy picture, and we have to master that figure first of all. So let us see the figure. So this is the figure of tributaries of inferior vena cava. So let us discuss tributaries one by one. This one is right inferior phrenic vein. This one is right inferior phrenic vein. This is left inferior phrenic vein, hepatic veins, left suprarenal vein, right suprarenal vein, right renal vein, left renal vein, left gonadal vein, right gonadal vein, right lumbar vein and left lumbar veins. These also are the tributaries. Median sacral vein is also one of the tributaries of the trunk of inferior vena cava and common iliac veins. So these are all the tributaries of inferior vena cava, and you have to master this kind of pictures to answer vascular anatomic multiple choice question that frequently asked in the Central Institute exams. So by mastering this, you can easily and effectively answer this kind of MCQs, and this MCQ will become a cakewalk. So let us look at the option again. Left inferior phrenic vein. Yes, it is the tributary of inferior vena cava. Because we have discussed in the figure that left inferior phrenic vein as well as right inferior phrenic vein, these are the direct tributaries of inferior vena cava. Let us look at the other options. Left suprarenal vein, no. It is the tributary of left renal vein, which is the tributary of inferior vena cava. Left gonadal vein, no. Right gonadal vein is the tributary of inferior vena cava. Left gonadal vein is a tributary of left renal vein. And right ascending lumbar vein is also not the tributary of inferior vena cava. So the answer here is left inferior phrenic vein. So with this, we complete our recall session of INI-CET 2023 anatomy recall questions. So thank you so much for watching and see you in the next one.